We're going to be doing this new pelvic floor series for the next 7 or 8 weeks on different topics of your pelvic floor. So I hope you guys leave with really good education and understanding about your pelvic floor. Here is our summer series roadmap. So today we have Love Your Pelvic Floor. Next week, and the following week. So we'll go through all of these key points. You're welcome to join all of them at this time, or you can kind of pick and choose which topic you really want to see, and then just make sure you save it on your calendar for the day and time.
Yeah, just sign up for each individual one if you want to come to any of the others.
All right, so this workshop is for people who want to stay active, doing the things they love without pain, meds, injections, or surgeries. It is mostly for women struggling with incontinence, pelvic pain, digestive issues, and wanting to feel confident and fit after having a baby, even if it's been more than 30 years.
And just so you know, we do treat men as well. So,
Today, you'll be empowered with the information you need to make a real difference to the way your body looks and feels, and the way, most importantly, the way you feel about your body. Health disclaimer. Please note this workshop is for educational purposes only and does not constitute as any form of treatment or specific healthcare advice. Attendees should seek the guidance of a qualified healthcare professional for pain or injury concerns. Private consultations with PhysioFit therapists can be requested and scheduled separately.
all right, and I'm Kim Gladfelter. I'm the owner and founder of PhysioFit. I'm also a physical therapist and pelvic health specialist and regenerative therapy specialist and Pilates specialist. So I started PhysioFit because I wanted to give people an alternative for holistic programs to help with natural, non-invasive alternatives. And we have, over the years, added a lot of integrative health to help people ongoing through therapeutic Pilates as well.
My name is Kelly Farhat. I'm an occupational therapist and pelvic floor specialist here at PhysioFit. I've been an OT now for 6 years and definitely found my passion within women's pelvic floor, regenerative shockwave therapy, stim pod, and certified in Pilates for rehabilitation. All those are my favorite kind of disciplines. So I graduated from Michigan State University back in Michigan and then did my master's in Miami, Florida. Here's what you will learn today. So we're going to be going over and understanding your pelvic floor, the muscles, the function and support that we are born with, the deep core, so your body's internal support system, the breath and how important that is to your pelvic floor connection, recognizing potential signs of pelvic floor dysfunction, and then what is pelvic floor physical therapy? What does that mean in the rehab world? And supporting your recovery here at PhysioFit. If you guys are patients of ours or have been to any of our workshops, you know that Kim has done a bunch of research on advanced technology to help facilitate a quicker recovery for you. So we may jump into regenerative shockwave therapy, and then we also have stim pod too. So we'll let you guys know more about that at the end. So where are your pelvic floor muscles? As you can kind of see in this diagram, we have our hip bones, and then we have this hammock-like structure at the very base of our pelvis. So these are a group of different pelvic floor muscles that kind of stretch from your pubic bone in the front to the tailbone in the back and kind of connect from one sit bone to the other bone, sit bone. So you have this nice hammock at the base of your spine and base of your pelvis that forms three different layers of pelvic floor muscles: your superficial layer, your middle layer, and your deep layer. What do your pelvic floor muscles do? So our biggest one is they support all the most important organs in our body. So you can think of your bladder, your bowel, and your reproductive organs, as well as your digestive organs. It controls bladder and bowel function. So it actually, the muscles help to hold urine and fecal matter, and they also help to release urine and stool from the body once the muscles relax for fully voiding or fully emptying out of our body. They also play a role in sexual function, so contributes to sexual sensation, penetration, and orgasm through the coordination of contraction and relaxation. And core and pelvic stability. So they actually work with your diaphragm and deep abdominal muscles to stabilize your pelvis and spine during movement. Pressure management, they respond to changes in pressure during coughing, sneezing, lifting, and exercise. So, as you can kind of see, the pelvic floor is dynamic. It really needs to contract, relax, and lengthen appropriately. We don't want it always turned on. We need that fluidity of relax, contract for varying movements throughout the day and pressure changes. So now I will talk to you about your deep core system, which we're all born with when we are babies. We like to call this our internal corset that holds everything in. So our deep core consists of your diaphragm. Wish I could show you guys at the top of the diagram. You have your diaphragm that sits under your rib cage. And then you have your transverse abdominis, your deep core muscle that wraps around your trunk. So it's actually in the front of your belly, on the sides, and in your back, connects to your spine. So when that tightens, it acts as a corset with the diaphragm as the roof. And then you have your pelvic floor muscles on the bottom, that hammock structure I recently spoke to you about. So that contracts and lifts up. Transverse abdominis contracts. And then in the back, you're covered with your multifidus. So those are small, deep muscles along the spine that provide spinal stability. Together, these muscles coordinate with your breathing and movement to provide stability without excessive tension. And I'll go a little bit more in the next slides. But yeah, so just recapturing, you have the top of your canister being your diaphragm. You have your abdominals being the front and the sides of the canister. You have your multifidus in the back, and you have your pelvic floor on the bottom. We have a success story.
Much more energized and my goals relative to what she's doing. The compliments have been some. Limitations I had were not going out as much for fear of having an accident while I was in public or in continuing the usage of products to control my leakage. Love some it created more energy in my body and released a lot of the stress and pain that I had.
And how did you like regenerative shockwave therapy?
Loved it as well. So it has totally restored or reduced the energy of pain in my left
Ankle.
No pain anymore, and my balance is much more steady and healthy. So I have much more confidence in my stability in life. And at my age, as an elder person, it's very important to feel comfortable about the ability to maintain your balance with no fear of anything.
Perfect. Well, thank you so much for doing therapy with us, and we'll see you around. All right, so that patient of ours, super lovely. She started with like 6 to 8 regular pelvic floor therapy sessions with us. We worked on coordination of breath and pelvic floor function and connection. Once she started to get a stronger idea of that, her leakage was just maybe very minimal to none. And we also did stim pod, which she loved, which I'll go into that more in detail later. And then we found out that she actually fractured her ankle bone 5, 10 years ago. And she said ever since then, her pelvic floor just hasn't been the same. And as professionals, we know there's a really important nerve that runs down the leg on the inside of the ankle called your posterior tibialis nerve. Their function is to control bowel and bladder function. So I chose to do shockwave therapy to help with the scar tissue that was maybe putting too much pressure on that nerve and not letting it work optimally. After I did that, she now just feels much more stable on her feet and her ankles. And she raves about how she goes out with her friends again and no leakage in her underwear, or she's not wearing any more pads. So she's made a really, really good recovery. She's sticking to it. All right. So breath and pelvic floor connection. This is so, so important. And we have this beautiful diagram showing us what is happening with our muscles on the inhale and then the exhale. So as we inhale, our rib cage should ideally expand and our diaphragm muscle actually moves downward, which then translates to our pelvic floor lengthening and relaxing. So they move in synergy when everything is connected. As we exhale, the rib cage will turn more inward. It will go down and in, which then brings your diaphragm up. And your pelvic floor gently recoils and lifts. So on the exhale, ribs will move down and in, which brings your diaphragm up, which contracts your lower abdominals, which then kind of contracts and pulls up your pelvic floor muscles. And yeah, everything is gentle. This isn't like a lot going on, even though it seems like a lot's going on, it's really subtle. And I think about like 10 to 15% of awareness of this happening.
Mm.
All right, so now it's your turn to try. And I want you to feel your breath and your pelvic floor movement. So let's see how this happens naturally. Place one hand on your lower ribs and place one hand on your lower abdomen. And I want you to close your eyes if you can and you feel comfortable. Inhale, take a slow, deep breath in through your nose and feel your ribs expand in the front, the sides, and the back. Allow your belly and pelvic floor to gently relax. And as you exhale, slowly out through your mouth, feel your ribs come down and in. Gently engage your lower abdominals and imagine the pelvic floor lifting gently, like you're picking up a small blueberry or zipping up a tight pair of pants, like jeans.
Mm.
Then inhale through your nose, feel everything lengthen and expand. Let go and then exhale. Feel the belly draw in and the lift of your pelvic floor. I hope you guys felt that. Really subtle. If you did not, that's okay too. That's very normal. This may be your first time connecting with your pelvic floor, your belly, and your rib cage. So, pelvic floor therapy is bringing awareness to all of this working together. So, it's totally normal if you don't feel it on day one, or you feel it's opposite than what I'm chatting about, and that's okay too. The goal is just to bring awareness and then we move from there.
And that's something we can help you with to get that coordination in a session.
Common signs and symptoms of pelvic floor dysfunction. This slide, we're going to be targeting our bladder. So you may have urinary leakage. That could be when you cough, laugh, sneeze, or it could be involuntarily where you're not aware of it throughout the day and we're leaking a little bit. Frequent or urgent urination. So maybe you're kind of going to the restroom 9 to 10 times a day or more. Urgency is when you look at a bathroom, you're running to the bathroom and you're trying to hold it all the way until you make it to the bathroom. So that sense of urgency, like, can I make it even to the bathroom? I hope so. difficulty fully emptying your bladder. Maybe you go to the restroom, but then you're like, oh, I still feel like I have more. You stand up and you're like, oh, I gotta sit back down because I have more to void. And then getting up multiple times a night. So getting up one time a night is pretty normal. That's not what we're discussing here today. But getting up 2 to 3 to 4 times a night to go to the restroom, then we have something we kind of want to look at. Pelvic floor dysfunction for your bowel. You could go down to use the restroom and you feel very constipated, or you feel like you have to really push and strain to get number two out. You may have fecal leakage throughout the day. Maybe you go for a walk, or you just notice throughout the day that there is some either liquid in your pants or like a smear of poop. Again, difficulty completely emptying. And then pain with bowel movements.
And that can also be if you have hemorrhoids as well. That could contribute to pain with bowel movements. And that's something that we help with as well.
And if there's any blood in the stool, too, you may notice. Sexual health. So pain with intimacy, a very common diagnosis that we see here. Affects a lot of women actually for varying reasons. Pelvic pain, difficulty relaxing your pelvic floor muscles. So you may not feel that lengthening that we earlier were discussing. You may not feel it at all. You have no connection with it. So that could be difficulty relaxing those muscles. Decreased sexual function or satisfaction with your partner. Kind of like avoiding sexual acts because of pain, discomfort, or just not having like a really true good orgasm too. Can be a pelvic floor dysfunction. Here are some kind of myth or reality. If you feel like the pelvic floor is weak, sometimes people will say, do more Kegels. That may be what people tell you and focus on the treatment on. So more contraction, more contraction, contraction. But we have found that more is not always better. That could maybe not help the symptoms at all, or it can make the symptoms worse. And the reality of it, it's not just about strength. The pelvic floor is very dynamic. So it's that balance and coordination of breath to movement, a mix of flexibility. So being able to relax those muscles to then contract them and get strength. And coordinating when is it appropriate to relax my pelvic floor and when is it appropriate to contract and lift.
And that's something that we can help if that is painful doing Kegels. That's something that we can help address before you may be ready to do them. Are you doing a Kegel exercise correctly? That's another thing that we can address. So one thing that you want to avoid is holding your breath. That is a very common scenario that people do and they don't really realize it until we educate them in a session with body awareness. So you want to make sure that you're just not squeezing really hard. So people have a tendency to just want to squeeze and overdo it. And that's part of what we educate people and help with coordination in the session. You also want to avoid bearing down and pushing. So sometimes people feel like they just want to push their urine out or push their bowel movements out, and that is not you don't want there's a way to do that safely so that you don't end up contributing to a lack of coordination of your pelvic floor. So during a Kegel exercise or pelvic floor exercise, you should feel a gentle lifting. Like you're typical cue that I give is imagine that you're stopping your urine flow or your gas. You're stopping gas so that you feel just those internal muscles working. And you want to make one of the keys is that you want to make sure that you're keeping your glutes and your inner thighs relaxed. So a lot of people try to pull really hard and they engage all of those muscles, and then it's hard to differentiate whether you're actually really getting the pelvic floor muscles working. So that's one of the first steps that we do to coordinate, just to make sure that, because a lot of people come in, they know they've heard of a Kegel, but they just don't really appreciate whether they're doing them correctly. So that's something we can help with. You want to also make sure that you're continually breathing. If you're holding your breath, then you're not going to be able to coordinate the muscles correctly. And you also want to make sure that another very important part that people miss a lot of times when they're doing this before we educate them is the relaxation phase is just as important as the contraction phase. So if you're contracting your muscles and you're focused on contracting, 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 and you're never really focused on also releasing them, then you're not going to get the coordination of the muscles working correctly. You could also end up really tightening the muscles in a way that's going to cause more problems.
And as we love to say here, movement is medicine. So our pelvic floor is designed to move. Not doing anything is usually not the case. So the pelvic floor is it's moving all day long. It's changing all day long. So the pelvic floor is walking, lifting, running, coughing, and exercising. And the goal is mostly, you don't protect your pelvic floor by doing nothing. You protect your pelvic floor by understanding coordination, breathing, and timing of when to use your pelvic floor correctly for your body. And here at PhysioFit, we teach you all of this. So we teach you how to improve your pelvic floor strength and coordination. We help you understand how important the pelvic floor is for men and women and how it supports your bowel and bladder function. We want you to understand how it's important to improve the circulation and the tissue health, so more tissue elasticity and lengthening for improvement, build confidence with your activities, and reduce fear around movement or activities that have previously caused you pain or discomfort.
Another side note to this is that sometimes when people have chronic back pain or hip or sacroiliac joint pain, SI pain, sometimes a portion of this, if it hasn't gone away with things that you've tried, it could be because the pelvic floor isn't functioning properly. So think of that like the foundation of your house. If the foundation is not stable, even if the core muscles, the sides of your house are, you're not going to have a good foundation. So it's a good analogy for people to get that understanding of how important that the pelvic floor is.
How our team can help you here. We have three pelvic floor physical therapists here. We have one occupational therapist here, which is me. We have shockwave therapy to help you connect with your pelvic floor and feel it quicker. We have Pilates. We actually have all the apparatuses, Cadillac, reformer, ladder barrel, spine corrector, springboards.
Combo chair.
Oh yeah, and the combo chair here. So any apparatus, if you're familiar with Pilates, we can demonstrate the movements here in the clinic so that when you do Pilates at home or in a studio, you now have that lens or that awareness to focus on in class. And lastly, stim pod, if there's any neurological component.
So if you have a neurological component to what's going on,
Yeah.
then the stim pod helps to reset the nerve. And it can
Mhm.
also help with pain modulation. And just as another note, the Pilates is a really good mix with the pelvic floor therapy because it's such a really important foundation to just making sure you have really good quality movement if
Mhm.
done correctly in a therapeutic way. So that pairs really well with the pelvic floor therapy.
Last success story we want to just bring to you guys. Shalini is another pelvic floor physical therapist here. She's been here with Kim for how many years?
I think since 2018 or 19. Yeah.
Yeah. So working with Shalini has been life-changing. I didn't realize that internal pelvic floor pain could be relieved, but her expertise helped me break a long-standing habit of being tense all the time. The regenerative therapy specifically helped loosen things up and significantly reduce my pain. Since starting treatment, I've also seen a major improvement in my urine control. It feels like Shalini is working magic. I highly recommend her care to anyone struggling with these issues. And I just want to point out that these testimonials, they're pretty vulnerable. And I always get excited when patients feel comfortable to share their story, either written testimonial or a video, because I think it's really important to keep talking about this topic of pelvic floor and not to be ashamed by it, but to embrace it and gain the knowledge almost to make you feel more powerful and have more control in your body and help other people feel more comfortable to share their story and connect and know that there are solutions just right around the corner. And now we'll pull up the chat box, and you guys are welcome to share with us any questions that you may have. Or you can say them out loud. I think I should be able to hear you.
One thing I want to point out is that what I've seen when people come in, sometimes people come in a little bit fearful of discussing these intimate topics initially, and then then they see that it is actually, even though it's not normal to have it's not, there's something that needs to be fixed. It is extremely common. And so that puts people at ease when they know that they're in the right place, that we have seen this before. We've seen a lot of people with these issues, and it's, that people feel comfortable asking us the questions that they might have not felt comfortable asking in the past. So you want to know the role of the pelvic floor during menopause. So a common situation in menopause is that you may get vaginal dryness and sometimes weakness in the pelvic floor, and that can contribute. You also get night sweats a lot of times, and these are things that we can help with the circulation of the pelvic floor on the vaginal dryness side, outside of just getting the cream, which is extremely beneficial for women going through that phase. Because a lot of times that contributes to pain with intercourse. And then there's also women that get more when the pelvic floor isn't coordinating correctly, and then they get more chance of some leakage. And so those are all things that we can help to coordinate. That's part of the treatment that we do.
And I love that question because more research is coming out with data on women's transitions in life. So our next topic on 8/26, so next Wednesday at this time, 12:15, we're going to discuss effects of a hysterectomy on the pelvic floor, C-section, and hormones. So how that reduction in estrogen plays a key role in your tissue elasticity, your dryness, and kind of how that all ties in with daily activities. So please tune in next week and we'll do a deeper dive on your hormones and how it affects your pelvic floor.
All right. Well, if there are no other questions, we hope you have a good rest of your day, and hopefully stay tuned for some other topics that we have coming up.
Thank you guys for showing up and being here. Have a wonderful week.